Welcome to the People Playbooks podcast today. Today's guest is Mark Evans. Mark has a breadth of experience. Currently, he's the CEO of the Markham Fertility Centre. He's got over 20 years experience leading some of Canada's most respected fertility and healthcare organizations. Mark sits at an intersection of patient-centered care and innovation and access. His work has helped shape fertility care across Canada, but inside clinics at the national level. Mark, welcome to the podcast today.
Thank you for having me.
Yeah, we were really looking forward to this one, Mark, because it's just such a cool topic that, you hear about, but not everybody knows about, right? And how big fertility care is, right? And I'd ask you, so take me how your journey got you here to being the CEO of the Markham Center.
Yeah, I mean, it's a long journey, actually. We're talking 2005, just out of an MBA program. And a friend of mine introduced to me the Ottawa Fertility Centre. And I thought, what the heck is Ottawa Fertility? I have no healthcare experience, just have an MBA and I'm young and stupid. And, but they needed some help. And I thought, you know what? This is really, really cool. And it's a really good way to start out a career in leadership and management. So they hired me for some strange reason to run the Ottawa Fertility Centre in 2005, 2006. And, this is one of these juncture points in your life that determines the rest of your life. And ever since then, I've been in this field.
Mark, you said, so 2005, first and foremost, you look like a young man now. I could only imagine how young you were at 2005. So as a young leader, so 2005, I'm assuming you're really just kind of starting your career, or you're just, like you said, you're just getting into it and you're leading that fertility clinic. What were the challenges of actually being a young leader, kind of coming into this and just saying, okay, you're giving me this piece of, it's like a gold nugget to run. And I've never really probably had much leadership experience at that point.
What do they say? Flight or fight? Right?
Flight or fight.
And I'm a fighter. And, it's interesting. When I first met the group and I met the nurses, healthcare workers are amazing, but they know what they need and they know what they want. And I just recall very distinctly the first time I met the nursing group and they said, you have no idea what you're getting yourself into, do you? And you know what? At the end of the day, it was very, very stressful. It was hard. But I loved the people that I was working with. The doctors there were amazing. The nurses were amazing. The staff was great. And not only did I see it as an opportunity to learn and build some competence, but I actually found it was an ideal way to actually make a difference in people's lives. So I just had no choice. I had no choice but to succeed, and I found a way to do it.
Yeah, I love what making a difference in people's lives. I can only imagine the amazing stories you can share, both probably happy stories and both sad stories as well, when you're seeing somebody that's saying, hey, we are, we're gonna be parents, we're gonna have a baby, or the verse, it's not gonna happen, right? How do you control those emotions along the way, being kind of that you see them all the time?
Good question. Healthcare is interesting. I mean, it's full of emotion, right? You're especially in this field like fertility, and at Markham Fertility Centre, actually, it's the one thing I think that we're really good at. We actually have a theme that we treat the patient journey like a story. And we have a tagline that the patients are the hero of their story. And we're just participants along that journey. And we're there to help them get to the end of their journey. So what is important about that is when you're a protagonist in a story, you're also the hero. You're also in control of that destiny. But there are things along the way that help you get to the end of that journey. And the emotions that are really for the physicians, it's very difficult, I think. You can just imagine every encounter could be extremely high emotion, cathartic, and it could be very difficult. It could be a sad story. You're doing this day in and day out, and the nurses are the same. So for them, it's really challenging to stay upbeat, positive, focused, and patient-centered every single appointment. It's draining. And the emotional journey is what keeps us going, though. It's that hope that people have that they're going to have a family at the end of the day. And, one of the things that we pride ourselves on is that the staff understand that journey, and they understand that the patients are at the center of it.
So when the staff understand that journey, they're human beings as well, obviously. I know they're used to being, doctors and nurses and whatnot. But there must be some emotions that carry with them based on just being a human being and having empathy, right? How do you manage that as a leader of a clinic?
Well, it's all about culture, actually. So look at my role, for example. It's evolved a lot. We talked about, starting in a role as a director of a clinic when I'm 30 something, naive and stupid and making mistakes versus today and a little over 50, maybe a little more than that. And the difference between then and now is I realized how important not I am, but the team is, and that my job really is to serve the staff. And if I can make their environment as easy to work in as possible and give them the support that they need, they also will do an amazing job. The truth is, they actually support each other. And we talk about our clinic as a family.
Yeah.
I've heard a lot, I don't know what you think about this, but a lot of people say you can't treat your staff like family. And I have a hard time with that idea. I
I
think
agree with you.
I
I believe you can.
they're people, they have aspirations, they want to achieve their dreams and goals. They hurt, they're in pain, they're getting married, they're having their own family. This is part of our ecosystem is that we're delivering care in. So if we don't look after that ecosystem, I don't know how the patients are going to do well.
Yeah, I love that. You sound like a very collaborative leader. And I love what you just said that about family because, yeah, a family, just as your own family, you have, younger people in your family, you have siblings, you have parents, you have grandparents, and everybody's at a different stage. Same with a workplace, everybody's at a different stage, right? So what stage are you at? And based on the stage that you're at, what experiences are you in right now so you can actually work with those experiences and make sure that they thrive, right?
Mhm.
I love that. And it almost surprises me that somebody says you can't treat them like your family. You spend so much time with them. You probably spend more time with them, quite frankly, Mark, than your real family.
Mm. I would actually argue that you might treat them better than your family. So,
Yeah.
right?
Yeah. Right. Yeah. Yeah, exactly. Because you might not have the comfort level you do with them with your family, but you're trying to get there. It's a journey along the
Yeah,
way.
it's interesting. So we have a lot of amazing staff at Markham Fertility, and we have a young woman who's wanting to get into medical school. She's so passionate about this field, and so she's on that journey now. And I asked her, what is it that's driving you to be a physician? And she's passionate. She really wants to help patients. And she asked me, why do I do what I do? And I said, for you, it's about the patient. And for me, it's about the staff. The staff are my patients, if that makes any
Yeah.
sense,
Makes
right?
total sense.
So
Yeah.
when you treat your staff like a patient, like they're human beings and they have a career and aspirations and goals, the energy you get by just treating people that way I think, is incredible.
Yeah.
Yeah.
Yeah. I can imagine how much you carry on yourself as well, just based on our discussions in the past. You probably have, like, when somebody's hurting on your staff, I bet you that hurts you as well.
Yeah, for sure.
Or
Absolutely.
reverse, if they're elated because of a promotion or something that they've done that's amazing for the clinic, I
Mm.
bet you feel elated for them just as well. You're a very serving leader
Yeah, but you know
from our
what though? It's actually not just me that's like that. It's actually everybody. And the doctors at this clinic, I had the choice to come back, and I was in Vancouver for a few years and had the choice to come back or not. And I came back because I felt that the doctors at this clinic not only cared deeply about their patients, but they actually cared very deeply about their staff. And that culture is permeated everywhere. So I may feel that way, but they also feel that way about each other. Obviously there's things that don't always work out well, but it's a mutual compassion that
How do
gets
you hire
people
for
through.
that? How did you get that? Like, you obviously did some work to get that.
Mm.
Mark, how did you grow that? How did you breed that?
Have fun, actually. It may
Uh,
sound silly, but we have fun together. We celebrate together. Sometimes we have difficult messages together. We're honest. I think being honest is a really important piece of it. Telling people the truth and where things are going, and being clear about your direction, not being not putting barriers up about who you are, and being vulnerable a little bit, I think helps. So it also is about hiring the right people. So we're very selective in who we bring into the organization. And I'm sure one person can disrupt that ecosystem very easily,
yeah,
right?
absolutely. They can
So
fast.
yeah. And I know you have a lot of experience in coaching and coaching leaders and building teams. So you understand probably pretty well how one person can be a poison. So we're very
Yeah,
careful, and we got great staff, and we
yeah.
make sure we keep them.
You said something there. You said we have honest conversations. And I
Mhm.
find a lot of leaders have troubles with those honest conversations because sometimes honest conversations, they sting a bit,
Mm.
right? And if they sting a bit, sometimes we have people on our teams that avoid those conversations because they just don't want to be as honest as maybe they should with that person or as direct as they should with that person. What are your thoughts on that?
Mm.
How do you so when you have to have an honest, direct conversation and it might not be the best message with somebody, how do you handle that with yourself?
Well, so it works both ways, right? And I, as a leader, as CEO here, also have to be able to receive honest conversations.
That's
So, and I learned a lot last year. We're instilling a new program, a new software program. It's a massive change and impact. And sometimes we get so stuck in our ideas about wanting to accomplish something that we forget the people that are actually impacted by what you're doing. And I had to put the tail between my legs and say, you know what, I'm sorry, I was pushing too hard. I was wrong. And she had to have the psychological safety. She had to have the environment in which she could express her opinion. And when you allow that to happen without repercussion, you allow them to express what's going on with them and why things aren't working well. You open up a new door of opportunity for collaboration. And then on the other side, so in my case and all of the leaders that we have here, it's not helpful to tell somebody something that is not true. So we've had individuals who maybe needed some guidance in terms of work performance or career, and you're not helping them if you're lying to them. So I think one of the things with age, like wine, you get a little bit better, right?
yeah.
You're also less afraid of what people think of you
Yeah.
and less worried about whether they like or dislike what you're going to say. It's more important that you say the truth,
Yeah.
right?
Yeah. Yeah. And it's just how you position it, right? You took over the leadership position after a long-standing founder. You
Mm,
basically that you had to make sure that that transition happened.
yeah.
What was the hardest part of honoring that legacy while still being able to move forward?
Well, when you inherit another, I mean, this Markham Fertility has been around since 1989. It's a 36-year history.
That's
A lot of good reputation, a lot of culture already ingrained into the organization, a lot of great things already. So it really depends on what you're inheriting. You may have to fix nothing. And then the other hand, you may have to fix everything. So we were not like that in this case. So the best way to honor the legacy is to be successful, right? If to propagate the organization, make it better than it was before. Like a father, do you have kids?
yes, I do. I
Yeah.
have 2 boys.
Do you
Yeah.
want you want your kids to hopefully be a little bit better off than you, right?
Sure.
So
Yeah.
I think the original founder, Dr. Mike Vero, who started this clinic many years ago, he had a choice to put this in the hands of private equity or put it in the hands of independent physicians. And he consciously made a decision to pick independent physicians for a reason,
Wow.
right? He could have made more probably with private equity, but like a grandfather or father, he wanted his child to grow up in a way that reflected his values.
Yes.
So we continued some of those values, but we had to make some systemic changes too, cultural changes. Some people were a good fit, some people weren't a good fit anymore, and that's okay, right?
Yeah.
That's fine.
Yep.
So the best way to do that is to bring people along the journey and show them where you're going and listen along the way and not push too hard. So take what's great in the organization and then figure out how you need to be better and then tell them why. So, but it will be different for every organization that you take over, right? The challenges
Yeah,
are going to be different.
and I don't think you even notice this but you said it in 3 or 4 answers now, which I love. You've talked about listening,
Mm.
right? And I think that leaders that listen to understand as opposed to listening to hear, it's two totally different ways to listen, right? Because then when you listen to understand, which you do, you can then become a problem solver. And you could actually understand. There's so many people that listen and while you're talking to them, they're almost on the edge of their seat, they're ready to give you their next comment and whatnot. And I think it's so ingrained in you, Mark, to listen to understand because without even knowing it, in about 4 or 5 of your points in our conversation, you've talked about listening, which is
Yeah.
refreshing.
I learned a hard lesson and I'm not actually, I have to work at it very hard. I'm not naturally inclined to be a good listener. And it's not because I don't want to listen. It's because my mind is going off in different directions.
Okay.
right? So it's not that I don't want to hear, it's just that I can't control can't control my
Yeah.
thoughts.
Yeah.
And I have to consciously work very hard to say, listen and reflect on what people say. But I learned that lesson in my first role as a manager when I thought I was doing a great job, and they told me, quite frankly, you're not a good communicator. Right. So there's an opportunity to we did some 360-degree feedback for the leadership team, and
Yeah.
it was very powerful. I have to say that changed how I thought about myself.
Yeah.
So I'm still working on it. I mean,
We're always working on it.
yeah,
We're always working on it. It's self-awareness is a journey. You're never quite there, right?
yeah,
But again, back to your previous point, somebody had an honest conversation with you, and you accepted that feedback. And that's the first step, accepting the feedback that somebody's giving you. So there's big things happening right now. So there's expansion going on. And I'd love to talk about expanding and access into Northern Ontario. That's a big move.
hmm
All right. And then what has this taught you along the way, basically, that, is missing in Canada with fertility care?
Canada is a challenge. It's so big, and
Yeah.
there's over 1 million people that live north of the GTA, Sudbury, Aurelia, places like that, Thunder Bay. A lot of remote communities, and healthcare is difficult to access there. And fertility is challenging because when you go through treatment, you need to go there over and over again. I think it was 5, 6, 7, 8 times. When
Sure.
you don't have the services, you can't travel 4, 6, 8 hours to
Every
Toronto,
time.
right?
Yeah.
So we had a
Yeah.
patient, really changed again my perspective. She had desperately done many cycles of IVF, spent a lot of money, probably over $100,000 at various clinics. I love the story. And she had one embryo left, or she had one chance. I think she was doing a cycle. The story is public, by the way. It's on CBC. And she was coming down for her one last opportunity. And she was traveling in the middle of winter, 4 hours from Sudbury, 4 o'clock in the morning, showing up at the clinic for her one last chance after spending oodles of time and hours and money. And you know what? So she had that transfer. She had more embryos than ever she had before. And she transferred that embryo and ended up with her first baby.
Oh, that's awesome.
So it's a very emotional story, really. I mean,
Sure.
just the dedication that her and her husband or partner put in to achieving that family, that they were willing to sacrifice. I mean, it's not easy driving along Highway 7 at 4 o'clock in the morning on a blizzary day. Like, you can
No.
imagine the
Yeah.
willpower to get there to achieve your dream. So she inspired us. She inspired Markham Fertility. She inspired Dr. Garcia, who was her physician, and our medical director here, and all the other doctors. And we felt, you know what? There's a lot of people in areas. GTA has lots of IVF centers. It's dime a dozen almost at this point. It's the people in the rural areas that will go without having a family. That's not
Yeah.
acceptable when we can
Yeah.
do it. So we've put a lot of energy with thankfully with the support of Renee, who's the patient. I can say her name because she's public and she's been in the
Sure.
media.
Yeah.
She's an advocate to set up places for patients to monitor, and so they don't have we can at least reduce 80% of their travel. Right.
Wow.
So if you asked a question earlier about patient-centered care, so I would say if we can minimize the effort the patient takes to achieve what they need to, which is to have a family, then we owe them that to do that, and it's doable. So we have places in Barrie and Innisfil. We have a partnership in Aurelia through Horizon Fertility. We have a partnership in Sudbury with Neo Fertility, and we also have a very big partnership with Dream Fertility in Whitby and Oshawa. And there are no IVF centers anywhere near there. So it really just inspired us that without that outreach, people will just go childless or not achieve what they want.
And did that happen with from guidance from you, or did the whole team kind of say, "Hey, let's make this better for people"? Because you mentioned a couple doctors in that. Did they say, "Hey, what can we do here"?
Well, you know what? I just think the whole team was inspired by it. And then we said, we have to do something. We talked about it as a team and just made that decision to go for it. It's not easy. Like, you have to set up a facility and partnerships, and there's a
A
lot
lot
of
of work.
effort in doing that. It's not without risk.
Yeah.
And but no, there are other clinics that do it to some degree, and we just felt it was something missing in the field of health, and we needed to do something.
Wow. I that's a phenomenal story. And that story was actually aired on CBC?
A year ago, I think
Okay.
it was a year
Yeah.
ago. Yeah,
Yeah.
maybe it was
Yeah,
2. I don't know.
absolutely.
It was January, February 2025 or 4. I can't remember. Anyway,
Wow.
her child is now over a year old. So
That's awesome.
yeah.
That's awesome. What a story.
Mhm.
That actually is a great segue into kind of where I want to go next is talking about innovation, right?
Mhm.
So innovation, particularly for your role, is bigger, right?
Mhm.
Because you're the CEO, you're the big idea concept kind of person in your organization. But healthcare is sometimes cautious by nature, right? So how do you decide when new technology or new ways or new ideas is actually worth the risk along the way?
I love this topic. I
Okay,
love
yeah,
it
let's
because
get into it.
what Jack Welch once said. He said, if the pace of change outside is faster than the pace of change inside, then the end is near. Right?
Yep. I love and I could go down a whole Jack Welch kind of way with you. So that I love that you quoted him. So yeah,
Yeah.
so yeah, let's go into that.
I've been, like you said, I've been in public and private, and I've been in a non-for-profit. And the one thing I felt in the public sphere in hospitals is they're so risk averse that I think the risk aversion becomes a risk in and of itself. You know what I
Uh-huh.
mean? So
Yeah.
if you're not changing and adapting, you're actually potentially not serving the patients better. So I really believe. I also teach, by the way. There's a master's program at University of Toronto, teaches embryology. It's the only program in the country that teaches embryology students to do the work of an embryologist. And I teach about innovation and the importance of taking your head out of the microscope and looking out, the bigger picture. Right? Where are we going in this field? Innovation in healthcare is phenomenal. The advent of AI, robotics, you cannot ignore and just do things the old way.
Yeah.
So you asked me how do I do this? Like this, obviously you can't pick everything, and not everything is
Yeah.
affordable.
Yeah.
Um, you have to figure out which problems need to be solved first, right? What are the biggest problems? So
Okay.
in Canada right now, cost is a huge problem, right?
Yeah.
It could be $15,000 or more, $20,000 for an IVF cycle. And it's not always successful the first time. So people could be spending 20, 30, 40, $50,000 just to have a child. We have to bring the cost down. So our view is that if we can bring the cost down through technology, which is feasible, without impacting the patient-centered care, without impacting quality, I think we can do it all. I think we can improve service, we can improve the quality, we can improve the cost and efficiency at the same time. So those are the things that we look at when I'm looking at technology.
Okay.
So we actually have a template. When we implement something, number one is, how is it going to affect the patient? Is it going to be a net positive or a negative? How is it going to affect the staff? Is it going to make their work life better or worse? How is it going to affect quality and outcomes? Is it going to have an improvement in quality or not? And then finally, how does it affect the bottom line? Like, is it going to be a net positive or negative? Not all of them have to win, but the staff know that we go through this measurement tool, this evaluation, this scale to see how is that technology going to change our ecosystem, right? And
Yeah.
sometimes staff may have to give up a little bit to get better quality service and outcomes,
Yeah.
right? Or
Wow.
we may have to give up some financial side for lower pricing for patients, or a better service or better outcomes.
What's the
Sometimes they all
biggest
work.
what's the biggest innovation you brought in recently?
Oh, we're doing a lot, right?
Or we could even reword that, Mark. What's the innovation that has made the biggest impact as of late?
Well, we're working right now on transforming our medical record. In the old days, it was the chart, and
Yeah.
then it was digital and
Yeah.
databases. Now it's got to be smart. It can't just be a reservoir for data. It's got to be smart and intelligent. So the one we're doing now is going to dramatically change the patient care. It's going to cost us more money for sure. For example, let me put this to you really clearly. So patients take injections almost every day. The
Yeah.
timing of that injection is really important. So we can now introduce a tool. The program we're going to be using is called WAWA. It's out of the UK or Denmark. the patient can now get a countdown of when they need to take that medication, indicate that they've taken it, and report back whether there's any impact to that. Is there a rash? Are they feeling any negative effects of the injection? We can document they took it at the right time. So we can push the care as opposed to read this 10-page instruction manual as to when you can
Yeah.
do something, and they can pull up the video to watch it at the same time. Like, that is transformational. Not only does it improve the compliance to the protocol, it makes it easier for the patient because she's getting just-in-time information and
Wow.
instruction. And then the staff is not on the phone saying, did you take your medication? So this is the one we're most passionate about. Now, we've done some other things, but this is going to be the most transformational.
Yeah, I love that you have a system. Like when you talk us through your system on
Mhm.
what are the pillars you look at before you make a decision, because I can only imagine it's probably like a fire hose coming at you, and you're like, okay, like you're probably like, okay, we can do this, we can do this, we can do that, and it's
Mhm.
just all this information because it's such a fast changing sector that you're in. I love that you have a filter on, okay, so let's put it through our kind of internal filter to see if it's actually, if we're going to make a go at it or not.
Yeah. You can't just pick the next greatest thing. You have to pick the thing that solves the most important problem, right? And there is a
Yeah.
tendency that clinics want the most innovative thing as a marketing tool, right?
Yeah.
We're the most advanced clinic. We've got this new AI technology.
Sure.
But does it really, like, what really is the benefit? And is it costing the patient more? So we try to filter out the noise and focus on the things that are going to change how we deliver care. But
I
there's a huge opportunity for health. Like, I honestly think AI is going to transform and create capacity in our healthcare system. And I really hope the hospitals and the healthcare system embrace that.
yeah, I hope so too. And I hope that in this field we get leaders like yourself guiding the people to kind of get to where they need to go for sure.
Yeah.
Listen, you've been generous with your time. Just got a couple more questions for you, Mark, because I'm really enjoying this conversation. First thing I'd like to ask you, if you had to look back at your younger self as a leader, what is the one or two pieces of advice you'd give yourself based on going through this leadership journey along the way and based on kind of taking some punches and having some wins and going through some valleys? What would be a couple pieces of advice you'd give to your younger self?
Good question. There's one of the most influential books I've read, forgive me, I can't remember the author at the moment. It's called Multipliers. Do you know this book?
I have. Yeah, I
Yeah.
haven't read it, but I do know the book.
Okay, so the basic concept is there's two ways to run an organization. Well, you can be the leader that is at the center of everything, or you can use the collective strengths and intelligence of your people. And I think learning that second model is strengthening the people and enabling them produces outcomes way more than you could do as an individual.
Wow.
So when you're young and stupid and think you know everything and need to prove yourself, maybe that's just a phase you need to go through. Maybe, and you have to learn your lesson, but sooner or later you learn it's not about me being seen as a leader. It's about what we accomplish. And the best way to do that is through your team.
Yeah.
Yeah.
Yeah. You said something key there. It's as younger people were a bit more driven by ego, right? And one of my favorite things to tell younger leaders is just be patient and sure, don't be patient in your journey to get to where you want to go. That I want a high sense of urgency there.
Mm.
However, when you're leading, be patient and listen and care and be authentic. Be authentic, right? Because people know when you're not being authentic, right?
That,
People know when you're saying the catchphrase of the day to show that you listened to a podcast or show that you were reading a book or whatnot. They know that, right? But when you're truly authentic and transparent in your leadership journey, it opens you up to being a better leader.
yeah, I think so. And same with everyone else. Like, you need to enable them to be authentic, right?
Yeah. I
Mark,
love it when leaders actually tell me they don't know. Like,
yeah.
as a younger leader, and hey, I was guilty of it. You feel like when somebody asks you a question, because I'm the leader of this organization, I need to know this answer. And you probably sound a little kind of like, what is this guy talking about
Mhm.
right now? Because you're like doing the hubba and you're trying to, but isn't it more authentic to just say, yeah, Mark, I don't know that. I've never had that question.
Yeah.
And you know what? I don't know it, but I can find out for you for sure. Or I know where I can go to find that answer out. But it's just so much more authentic when you answer like that.
There's a video I once saw. It's with I guess they're at Elon Musk has his base. I can't remember what the rocket. What do they call it? SpaceX.
Yeah.
And he was saying, I guess it was an engineer, an observer, and he was saying, you should do this. And he turned to the person, he goes, but we do. And then he stopped and he said, you're right. And just that moment, like he didn't have to prove that he was right. He was like really curious and the right way to do things.
Yeah. Yeah.
As a parent, it's kind of the same thing, right? As a
Sure it is.
father, you can't always be right to your kids. The hardest thing I ever had to do is admit to my kids that you're actually right. I was wrong. Apologized.
Yeah.
I'm sorry. Learning to say sorry to your kids is not easy.
Yeah. Yeah. You're so right. We wanna be that person that always fixes things. And sometimes our kids can actually fix things about us
Exactly.
along the way. Right. So,
Yeah.
Mark, first and foremost, I want to thank you for your time. Absolutely fantastic conversation. The listeners are going to get a lot out of this because I've had some really cool conversations with you before this podcast, obviously. And,
Mm.
you're doing some great things. You are an authentic leader. You're very transparent in the way you do things. And every single time we talk, there's a mention of listening. There's a message of collaboration. There's a message of, being a little more humble. And you always give some great advice, which
Mm.
I take along the way. So I want to thank you for your time today.
I just want to say,
And
just sorry if you don't mind, just to say it to
yeah.
you. I think what you're doing is amazing, and
Oh, thanks.
I think you're filling a hole in Canada. Canada has a lot of room to grow and learn from the amazing people that lead and run organizations. And I think your podcast is going to create a uniquely Canadian, maybe bigger, but having these conversations, first of all, I'm grateful and appreciate that you invited me on to your program. I would listen to it, and I do listen to it, and I think that you're adding a big service to our business environment. So thank you for that.
I appreciate that, Mark. Yeah, I'm a big believer that the world needs better leaders right now. And yeah, we need better leaders. And it's a journey. And the hardest thing that somebody can do, the hardest thing, in my opinion, that people do is lead people. Like you don't have a book or a manual on that. Yeah, sure, there's 1,000 different books and podcasts and all that stuff, right?
Mhm.
But at the same time, you have to make it your own and you have to be authentic because you can't just script it in a way that says, hey, when you say this, I say this and whatnot. So
Mhm.
I appreciate that. Thank you very much, Mark. I appreciate your comment. And coming from you, it means a lot. So
Thank you.
with that, I'll let you get back to your day, Mark. Thank you so much. Keep your leadership journey fresh and thriving along the way. And I look forward to an amazing relationship with you throughout the next few years.
Awesome. Thanks a lot. Take care.
Awesome. Thanks, Mark. If you loved that session and that conversation as much as I did, would love to have you join our People Playbook community in the link below.